very good afternoon to all of you. We are starting our session on business opportunities on integrative healthcare. In fact, I have a very esteemed group of people who, as panelists, and I'm actually lucky to be here to be moderating all of these great thinkers and people who have been doing work in integrative medical sphere. So we would like to, since we have about an hour's time on this program, we will try to divide the program into about 3-4 different question groups, which would start with, we will try to understand what each of our panelists has as a concept regarding what is integrative medicine, and then we would also look at their concepts one by one on why they would like to think that integrative medicine is important, and then we would come to the question of how and which are the areas, and then if there are business opportunities, if they find business opportunities, if they have already found business opportunities, we will talk about that, and then we will try to have specific points which we can take home as our message of this panel discussion. So as to begin with, I would as a person who had been working with integrative medicine for the past 7 years, I would say that from my concept, integrative medicine is when people work for the benefit of the patient. Like different systems of medicine come together for the benefit of the patient, and as simple as that, it is integrative medicine. But there are different forms of integrative medicine and different understandings of integrative medicine across the globe. Sometimes it is said that two different systems of medicine has to come together, then it becomes integrative medicine. Or probably I have found that even if you decide deliberately that 2 different systems of medicine does not have to come together, that's also integrative medicine, because you understand something for the need of the patient and you find that it is not necessary to combine together, then it is of course a knowledge-based decision, and that is also integrative medicine. But I would like to start with my panelists and their opinion. Can I start from Dr. Sajikumar in this line, so that sir, I would like to know what you would define as integrative medicine.
Thank you, Dr. Gita Krishna and fellow panelists. See, integrative medicine, there are 1 or 2, 3 concepts. That is, when different disciplines come together for a common cause, and for a particular disease. That means a discipline may be handling, maybe allopathic system may be handling the diagnosis and cure, and maybe the other systems like Ayurveda handling the prevention as well as the rehabilitation. So here one system stands as the foundation and the other system revolves around it, something like a pivotal model. That means the responsibility of treating or curing the patient actually lies with those who actually anchor the or diagnoses the cases. For certain cases, like different disciplines will come together, it will be a parallel approach. They have their own identity, and they come together for a common cause and to give a result to particular case. The example of autonomous self-driving car, wherein there is you cannot say whether Google is anchoring or whether Ford is anchoring the show, because they both come together for a common cause to give a result to to address the need of the customer. Likewise, if nowadays the customer, the need of the patient has been changed, because the human being is continuously expanding. So the need has changed. According to the need, to address the need, it is not just diagnosis and cure. We have to see the prevention, the rehabilitation, all the things. When all these things come together, only we can say that the need is totally addressed. So where we have to have a parallel approach, or we have to have this kind of a pivotal approach. This is my understanding on integration, and we will talk on.
Yeah, I'll just make some very rapid remarks. First of all, we're not talking about a concept, integrative healthcare. It's already there on the ground. So far as the common citizens are concerned, health-seeking behavior all over the world is showing that 40 to 70% of the population exercise pluralistic choices for their health needs. No one goes to one single system of medicine anymore. For something you go to someone, to one system, for something else you go to someone. So integrative healthcare is already there on the ground insofar as the decisions of citizens are concerned. The problem is that the fuss is all about policymakers who don't understand. The fuss is about professionals who don't understand. And these are the people who are keeping the further maturity of integrative healthcare, delaying this maturing of this entire program. The citizens have already taken that decision and they are exercising those pluralistic choices. Now, to my mind, the only way in which wholesome evidence will come out, if we are talking of evidence-based medicine, let me tell you that there is a myth in your mind if you think that modern medicine is full of the greatest form of evidence. It's not true. The quality of evidence of modern medicine is poor. I'm using this word very, very responsibly. No matter what statistics tell you, there's hardly any evidence of any kind of modern healthcare which is based on multi-centric meta-analysis of performance. It's always based on some small trial. The meta-analysis is based on very small samples. They must be multi-centric. So even the American Cardiology Association, so in modern medicine you have evidence type A, B, C. C being, let's say, the lowest, and these are all defined terms. Today, the evidence that is going into healthcare is of C type, not of A or B. In modern medicine, right in the frontiers of modern medicine. So the nature of evidence is unwholesome, is limited. It's the same story with other systems of medicine where even that level of evidence doesn't exist. You have good clinical outcomes, but you don't know what is the mode of action. So integrative healthcare is the only platform which can improve the quality of evidence in healthcare. So that's the second point that I'm making, that it's already there on the ground, but if you want evidence for integrative healthcare, it will only happen through this integration happening in a systematic way. The quality of evidence will improve. The third point I want to make about integrative healthcare is that it is essentially a transdisciplinary program. It is not interdisciplinary, it is not multidisciplinary, it is transdisciplinary. And transdisciplinary means in inter and multidisciplinary you combine disciplines that belong to one particular intellectual tradition, namely the Western cultural intellectual tradition. So biophysics is an interdisciplinary area, or town planning is a multidisciplinary area, but it's all within Western cultural intellectual tradition. If you want integrative healthcare to happen, then the oldest systems of healthcare have been traditional systems which are not part of Western cultural intellectual tradition. Now when you combine, for example, Ayurveda and allopathy, it becomes transdisciplinary, because the foundations of Ayurveda is another theory. It's Panch Mahabhut Siddhant. The foundations of science is molecular biology. It's a very different kind of a foundation. And so therefore, if you want to promote integrative healthcare, transdisciplinary is the framework we have to move into. And finally, I just want to say in this opening remark that if you are looking for not disease management but healthcare, then integrative healthcare is the only thing that can take you to health and not disease management. Otherwise, the whole of modern medicine is disease management. It is not healthcare. I stop here.
Yes. Now, what I would want to focus on here, it's not just a matter of integrated healthcare, That suggests to us, which is to me more important, an integral view of the human being. What we have in modern medicine today is essentially a chemical view of the human being and of health, even at a psychological level. The success and the need for integral healthcare is also showing us that we are integral beings, which means we have to be approached at all levels of our life and activity, relative to our health and well-being, diet, exercise, how we breathe, how we use our senses. All of these are part of that lifestyle, behavioral medicine. So integrative medicine is also moving in that direction of integrating these other disciplines that address the other aspects of our lives. And this means that in the long term, we need a broader integral view of the human being, health, and medicine. Now in Ayurveda, that's also introducing transcendent concepts like prana or consciousness that are not simply reducible to chemicals. Now, in terms of treatment, it also says it's not just a question of randomly combining disciplines to treat a particular disease, but finding out what works best for the different aspects of our nature. What is our proper diet? What is our proper exercise? How we should breathe? How drugs can affect us at a certain level, when they are needed, when they are not. So we need then to have a trained medical practitioner who has an overview and can help us then understand these different options. And then we also need healthcare centers that offer these different options, not only for the treatment of disease, but for addressing the integral nature of the human being and positive health. Healthcare centers that also offer massage, yoga, education, that also teach us not simply how to treat disease, but rasayana, rejuvenation, strengthening immunity. So in other words, the model of the human being and the disease process that we find in traditional systems like Ayurveda is what is emerging behind this movement towards integrative healing and integral medicine all around. And we should recognize that this new paradigm is needed. And it's not only a modern scientific paradigm, it's one we find in these traditional systems that are connected to these ideas, prana, consciousness, behavior, human values, and that look at the human being as a whole in the context of the environment and nature and a process of right living in harmony with all the natural factors of life, whether it's food, sensory impressions, or thoughts, so that we can then create a way of life that nurtures the human being on all levels as integrated and an essential component of our healthcare.
So, I would like to just start talking about integrated medicine by first defining what I call complementary medicine. We run a chain of high-end tertiary care hospitals, so I'll give you a perspective from the provider side. For me, complementary medicine is when you take typical, what is called modern medicine therapies, and you complete those therapies and then you attach on kind of at the end some kind of so-called traditional therapies. So you could go for surgery, and then for pain management post-operatively, you would do, let's say, some kind of Ayurvedic treatments. To me, this is complementary medicine because the Ayurvedic treatments that you're giving, frankly speaking, the surgeon who has performed the surgery is not interested, doesn't care, it doesn't affect his particular treatment. I don't consider this integrative medicine. It is very important, it is being done, but I consider this complementary medicine. I think truly integrated medicine is when we can establish combined clinical treatment protocols where you have different schools of medicine, Ayurveda, Tibetan, Chinese, modern medicine, all coming together, and instead of following a certain treatment protocol that you would only follow in one stream, you actually have changed the treatment protocol, you have new SOPs, you have new clinical pathways where you are actually integrating all of these, and the clinical pathway that evolves from treatment is actually better than the one that would exist if you only followed one system of medicine. So I think in terms of treating specific diseases, what I consider integrated medicine is when you can have integrated, truly working together clinical pathways. Now, as is mentioned by some of the panelists earlier, this is only one part of what we do. This is not the healthcare part. This is the disease care part, or rather the disease management part. The other part that comes into integrative medicine, which frankly speaking, even in modern medicine practices alone is missing, is the health part. So today, if you look at a patient who has cancer, maybe they will get chemotherapy, maybe they will get radiation, maybe they will get surgery. But what else? Hugely missing is mental counseling, diet counseling, lifestyle counseling, exercise counseling. So you may come into a hospital, you may get so-called cured of your cancer, but at the end of that, we leave you and we say that, okay, now our job as doctors is done and you're on your own. So we don't actually bring in any of the elements that was discussed earlier around health. You don't bring in any of the elements that was discussed around aspects of mental health. And you don't bring in any of the things that got you there in the first place, which if you don't address, will probably land you in hospital again. So I think that you have to look at integrative medicine both in terms of the truly integrated clinical pathways for managing disease and the integrated medicine that will ensure that we can actually address the issues of health.
So I'd like to start by going back to the basics. Now, the World Health Organization defines health as a state of complete physical, mental, and social well-being. So I think integrated medicine is a means to achieve that, a state of complete physical, social, and mental well-being, and not just the absence of disease. As an allopathic doctor, the barrier that I see to this integration is the concept of health and disease being different in allopathy, in homeopathy, in Ayurveda, in naturopathy. For example, in homeopathy, the concept of disease and its cure lies in like treats like. In naturopathy, the concept of disease and its cure lies in morbid matter accumulating in the body is the cause of all disease, and removal of that morbid matter is the cure for all diseases. In allopathy, there are multiple causes, bacteria, viruses, autoimmune reactions, and there are multiple treatments. So the basic thing that we need to resolve is if we have to have truly integrated medicine, is the basis, is evidence-based medicine. You know, that's what allopathy agrees to. That's what homeopathy, a lot of people say it's placebo, but it really isn't a placebo if we look at the evidences. Ayurvedic researchers like Medanta is doing a lot of research into integration with the allopathic treatment. So evidence-based outcomes, researches, I think as an allopathic physician, that is the basis which is absolutely necessary. One of the panelists mentioned that that this integrated medicine is already in place in the world. 40 to 70% of the people are already using pluralistic forms of medicine. Unfortunately, what is happening now is it's all disconnected. I'll just give a little example of a patient who was on warfarin, which is a blood thinner, and he went on coming back with repeated episodes of bleeding. Now, the doctors were confused as to why is he having repeated bleeding, because they were constantly tapering the dose of warfarin. So after talking to the patient, maybe for 5-10 minutes and digging a little bit deeper, they came to know that the patient was also taking an alternative system of medicine. I'm sure that had some amount of warfarin in it. So this kind of disjointed integration would not really help either the patient or the care providers. So connected integration of medicine based on clinical research, based on evidences, is what is the need of the hour to actually achieve healthcare in its real sense.
Thank you so much, Dr. Sumana. In fact, all the panelists. So we have tried to define what is integrative medicine, and we already know it's already been said there, and it is already on the ground. It's not something which we need to identify or discover. It's already there, and it is transdisciplinary in nature. It is a coming together of different systems of medicine for the benefit of the patient, and it has to have an integrated human. It should be more humane, and it should try to understand the human psychology and the mental and the physical aspects of humans quite well. even in terms of research or even in terms of clinical activities. And it is a combination of different systems of medicine to create a better clinical pathway. That's what one of the panelists had said, Dr. Ms. Pankaj had said like that. And it should address health. That is one thing which we had all been talking about. But it is very clear that it should try to achieve the full health, which probably what Ayurveda had said in Samadosha Samak Nischa. Or it should also try to explain health in terms of what WHO has defined health as. It should be evidence-based, and it should also be connected to, it should not be a disjointed combination of different systems of medicine done by somebody, but it should be a knowledge-based combination of systems of medicine for the benefit of the patient. That's what we finally, or rather, that's some kind of an idea about what integrative medicine is. Now, I would like to ask our panelists why we should have integrative medicine. Of course. Before we go forward, do you want to take questions?
Yeah. One of the thing is, we are a country of lot of brain, lot of manpower. When it comes to disease management, there is always a concern for the medicine is evidence-based. We know the medicine works because it has worked for thousands of years. Is there any way to conduct a clinical study, say 1,000 people, 10,000 people, and a well-established medicine, and we will show it indeed works, and publish that study in a peer-reviewed publication and create clinical evidence? Is that possible? Because my feeling is, even though poor evidence is better than no evidence, and we have the ability to create evidence, why are we not putting effort to create evidence?
I would like to answer that question because, first of all, it doesn't exactly pertain to the current situation which we are talking about. We are talking about integrative medicine. But I would like to tell that we are already doing clinical trials. There are already peer-reviewed journals publishing data on such large studies. Like the largest of them would actually be 50,000, like patients who had been covered on an NCD. But I think that is a different group of discussion which we might not be interested in taking in this particular session, because here we are dealing with integrative medicine. But your answer is that it is possible and we should do that. If we can go ahead with the session, can we do that? Okay, right. Yeah, thanks. So we would like to ask why we are doing integrative medicine, and I would actually start with Sumana, if you can. What's your opinion about why we should start integrative medicine, or why we should have integrative medicine? Is it necessary at all?
So modern medicine is not a perfect science. 2 plus 2 can be 4, can be 400, can be minus 20. The same patient can respond very differently to the same medication given, to the same surgery done. So there are limitations of modern medicine. There are limitations of alternative systems of medicine. Say, for example, a patient is having an acute MI, a heart attack. So obviously you need to intervene. You need to give some injectables to save the patient's life. If there's a case of trauma and there's a pelvic fracture, you need to operate immediately. If there are certain endocrine disorders where I've seen alternative systems of medicine working wonderfully as a supplement to modern medicine. So I think this is required because no system in its own is able to provide health in its real sense.
Right. Thanks.
So I think in addition to what Dr. Sumana said, to answer the question of why integrative medicine is required, first of all, modern medicine is essentially a very dangerous form of treatment. All modern medicine is essentially got 3 bases. You burn it, you cut it, or you poison it. And all of these 3 things are basically damaging the body. So whether it is surgery or radiation or medicine, you are creating a negative influence on the body in an attempt to beat a more negative influence. So integrated medicine actually offers you the opportunity to try to reduce the harm that you're doing on the body by trying to treat disease. I think that is the first reason why it is required, and frankly speaking, already being practiced. The second thing, and particularly important for us in India, and frankly speaking important for about 2.5 billion people around the world, is we cannot afford modern medicine. There is not enough money in the whole world to treat all of India and the diseases that we have with modern medicine. So if you look at the cost of modern medicine, it is phenomenally expensive. Buying these expensive lasers and radiation equipment costs a lot of money. Having hospitals and ecosystems where you can do safe operations costs a lot of money. And frankly speaking, the drugs that are created, sold, cost a lot of money. So if we want to actually be in a position to figure out how are we going to provide healthcare for the billion plus people who live in India, for the other billion people who live in Africa, Asia and other parts of the world that can't afford modern medicine, we have no choice but to look to integrative medicine.
Yes, the modern medicine is essentially the medicine of the battlefield. That's how it was created. And it's also more effective for acute diseases, accidents, injuries also. But the majority of problems that we have, and particularly today, are chronic diseases and also with the psychological ramifications. And for those types of disorders, the integrative medicine, I believe, is going to be much more effective. And we have to deal with the human being more as a whole and look to the combination of all the necessary modalities to balance the lifestyle and to bring the person to a more positive view of themselves and a more positive way of living. Whereas the drug-based medicine of manipulating the chemistry keeps you at a superficial level and has many side effects over time. So I think the integrative medicine is simply the necessary health paradigm for these broader-based chronic and psychological diseases that are coming up, and for which the drug-based medicine is really not that effective in treating, particularly long-term, and for which this drug-based approach, we don't know what the long-term side effects are going to be on the populations as a whole, generational, but we can see the positive health-giving aspects of the integrative medicine, and that is what we need.
I think I'll speak later on the opportunities because I have nothing to add. I think the speakers have spoken very well.
Yeah. Like what we know, integrative medicine, whether it is required, because the modern medicine or any system, it is not perfect or complete. So in any healthcare delivery, any delivery systems, three things are very much important. One is the cost, the other one is the time, that means how faster we can give result, and how efficient or how better we can give result. So the emerging diseases nowadays, it is than communicable disease, it is more of non-communicable disease. The expenditure wise, the government spend or the per person wise, individual wise spend, everything is going high. So when we integrate, the cost can come down, the government expenditure can come down. And in terms of faster, giving better, speedy results in lot of disease, especially in lot of NCDs, in metabolic syndrome, lot of cases, I think if you combine, if you really like what doctor said, if you campaign in a positive way or with knowing the scientific facts, we can give faster results. And also, it is better for the patient, that means in terms of just going through a lot of invasive methods, and so the patient will be stressed if you follow maybe, especially the allopathic system and undergoing certain chronic diseases. So in between, if they come across with other systems, the patient, the mindset, the stress levels, everything can come down. That is it.
Thank you, Dr. Saji. In fact, what we understand is why we should have integrative medicine, because the current system of medicine which is prevalent is not complete, and integrative medicine helps to complete the whole disease management program, and it also is a health improving program. It also is reduces trauma, it improves patient outcome, and reduces cost, which is very important for an economy and a country like ours, and especially most of the humankind. and it is basically, modern medicine is an emergency medicine. It is not meant for being managing the long term chronic diseases of humankind. So we require another approach, which is basically the traditional systems of medicine are rightly made for that. Whereas the modern medicine is made for war. The other traditional systems are made for people who are living in peaceful times. So therefore, it is very essential that these two systems of medicine come together, and integrative medicine is the right approach. That's what we are understanding right now. But I would also, because when we are talking about integrative medicine, we are mostly talking about the clinical aspects of integrative medicine. So I would like to know from our panelists whether there are other dimensions in integrative medicine. If Pankaj, would you like to, we are talking about hospital-based integrative medicine or clinical-based integrative medicine. Can we think about other dimensions in integrative medicine, just?
Yeah, so I think that this was touched on by some of the panelists earlier, and again, when you talk about healthcare or when you talk about disease, and various studies have shown this, in fact, in the West, maybe because it's being driven more by insurance than in India, you actually find that most illness actually doesn't happen because of what we traditionally think of as diseases that we may inherit from our parents, or because of conditions that may be associated with this. Most disease actually happens because of our social environment, because of the lifestyles that we live, because of the mental status that we live our lives in. So, and there are various studies that have been done in the US that they actually can tell you that the actual neighborhood that you live in and the kind of housing ecosystem that you have actually is more correlated with your likelihood to get disease than anything else. And that is simply because if you take, for example, if you're single, living alone, living in unsanitary conditions, not able to have healthy food, cannot have a stable job, you actually are putting yourself much more at risk for getting all kinds of various diseases. Now, what integrative medicine can allow you to do is that integrative medicine can allow you to actually manage your health on these dimensions. And I think it was touched on earlier, I don't know whether it was on the panel or whether when we were discussing earlier, we talked about yoga, we talked about mental health, we talked about diet, we talked about lifestyle. These are the things that actually will drive health. So if you go to even a modern medicine practitioner today, what they will tell you when they talk to you about how to stay healthy is basically always only 3 or 4 things: diet, exercise, mental well-being, and we now call all those 3 things collectively lifestyle. There is actually no other way to prevent disease other than these 3 things. So if you look at integrative medicine and you are looking at saying, how do we keep people healthy? How do we keep them out of hospitals? How do we ensure that they can actually lead healthy lives? There is no answer in modern medicine. The answer actually lies only in integrative therapies.
In fact, Professor Darshan Shankar, would you like to talk about other dimensions of integrative medicine?
Yeah, there are many dimensions outside of regular clinical. I think there's a public health dimension. I refer to this dimension as the 4th tier. That means, why are we looking at hospitals, clinics, doctors as health providers? You yourself are a health provider. Millions of us can provide help, self-help to ourselves, and that's a lot of knowledge available which can, help you to keep healthy. It may relate right from diet, lifestyle, kind of yoga kind of things, to common ailments, home remedies, herbal solutions, clean drinking water. We had in this country this tradition of storing water in copper vessels. It was one of the most healthiest traditions for keeping the quality of your drinking water, because overnight storage of water in copper vessels releases from the copper around 150 parts per billion of copper ions, which completely destroy every single microbe: E. coli, Salmonella, Vibrio cholera, rotavirus, Giardia. Plus, consuming that copper ions into your body is good for many of the physiological functions of the body. So, I mean, there are so many solutions that particularly in this country, and I'm sure it must be the case in other countries with rich traditions like Africa and Central America and in fact all over the world, I think that a lot of healthcare was in the hands of individuals, in families, of communities. So that's the fourth tier. There's enormous scope today to revitalize that fourth tier, and that can come out of this framework of integrative healthcare. Another great thing that can happen is that why are we only creating these hospitals for disease management? You can actually create very sophisticated wellness centers based on a wellness science, not merely on wellness practices. Today the wellness industry is very huge. It's going faster than the pharmaceutical industry, but it's only a bunch of practices, you know, and they are relatively arbitrary. You can go to the best spa in the world, and I can guarantee you that you're only going to get a set of practices which are arbitrarily administered. You can actually design wellness based on this great concept that Gita quickly narrated, the definition of swasthya in Ayurveda. Swasthya, to be sthit in swa, to be in equilibrium with yourself. And self-equilibrium or health equilibrium happens at 6 levels, 7 levels, at the level of your physiology, samadosha, at the level of your body tissue, samadhatu, at the level of your metabolism, samagnis, at the level of your excretory system, samamalakriya, prasanna indriya, manasatman. You know, that is the definition of health. Now you can create an entire practice around this, measure your status of health and make interventions. So, you know, you can create a wellness science. You don't need to have hospitals which are only dealing with disease. You can have centers which promote health. And so that's another huge potential of integrative healthcare. You can, you know, if you want, make biomarkers for samadosha, samadhatu, etc., so you can bring that integrative factor in. And there are people working on this, mind you. In my university, we have actually produced a wellness checkup with a wellness score, not a disease score, a wellness score, based on this idea. And I think very importantly, integrative healthcare can actually create original contributions to the world of healthcare. I mean, today we are moving at the frontiers of healthcare in the following directions. We are talking about immunotherapy replacing antibiotics. There's no way in which you can move forward on immunotherapy without an integrative healthcare framework. No way. So you will make original contributions. I mean, it would be great if you can live and let live with your microbes. That's what immunotherapy is in a very lay language. But it involves tremendous amount of integrative healthcare. It involves science platforms which look at, immunobiology. It looks at traditional knowledge interventions to test on these platforms and so on and so forth. So you can make original advances in immunotherapy, in regenerative biology, in the whole business of what is called microbiomes, the balance of the microbiome in a personalized way. So I won't get into these highly technical subjects, but you know, they can make completely original contributions to the world of medicine. So there's a huge potential.
In fact, I would like to get your opinion, sir, on Dr. Frawley, on the dimensions of integrative medicine. Like, if you have something to add.
Yes, well, first of all, I agree with everything he said. I just put a big marker here, public health. And public health relative to integrative medicine is also a place where we can prove its value. See, a lot of modern medicine is proving the value of specific drugs for specific diseases, but that doesn't necessarily raise the health status of the person overall. So integrative medicine and positive health is a very important factor. As he mentioned, immunology, prevention of disease, and also for rejuvenation. We have an aging population particularly in the Western world, but even India will come to that in not too long. So for dealing with those issues of aging, the integrative medicine is extremely important. Then there's also a community factor relative to health and well-being. A lot of the psychological issues in the Western world are from loneliness, people living alone. We see a breakdown of communities over the world. So integrative medicine also provides a wellness health community for you to be part of that offers services not only to treat specific diseases, but also to raise your level of health and well-being overall, to give you educational connections, and to bring back that human element into medicine that the chemical view of modern medicine has been removing. So I would see it definitely as the medicine of the future, and also it reintegrates us with nature, in which the great healing factors occur, not only through herbs, but through living in nature, through being connected to other human beings, and for recognizing the ecological and greater biosystem behind both health and disease.
In fact, I would like to request Dr. Sajji, because he's basically, he's also a clinician as well as a pharmaceutical manufacturer. So does he have any ideas on integrative medicine other than from the clinical aspects of it? Do you think that there could be dimensions in the pharmaceutical sector in integrative medicine?
Yeah, especially from a clinical side to when it comes to the medicinal side. So we usually customize certain products, especially when for certain chronic conditions. For example, if a patient suffers from maybe bipolar mood disorder or something like that, they may be presenting with maybe obesity or maybe some liver enlargement or with something like of that reasons, where we usually find some medicines which is good to the liver, and also we will not ask them to stop their medications. So the medicines which we define may be certain decoctions like Vashagulu, Chadikasha, Kwadam, etc., which we give based on their nature without adding any preservatives or something like that. Because further, let us not add any kind of even just avoid preservatives itself, like kind of preparations to the and also certain food. Kind of thing is being we design to be given as a practice. Medicines will be added to the food and be given. For example, especially in case of diabetes, even they are in a condition of maybe taking high-end maybe insulin or etc. We will actually use triflucodam in using making some products being prepared in, or some food is being prepared in triflucodam and will be given, where the glycemic index can be managed. So such kind of a customized approach on products, depending on certain cases where the modern medicines cannot be, or allopathic medicines cannot be withdrawn immediately. For certain cases where they take statin, we usually give medicines which is actually helping their body to revive or regenerate. So this kind of approach is being done based on the condition of the patient. It will be one-to-one approach.
Dr. Sumila, is there any research approach which you think which would be, like, especially in pharmaceutical industry?
So the concept of reverse pharmacology that they use perhaps can be taken a little further. The side effects of certain allopathic medication, for example oncology drugs, they are known to create a lot of nausea and vomiting. So the side effects or the symptom management post either chemotherapy or radiation therapy, if there's something there, that would be very helpful. I think there's another thing that I'd like to mention, which is expanding the scope of integrated medicine. If we just go a little bit beyond disease management, we're actually managing health of the population. And if we have a healthy population, this will have a direct impact on the productivity and hence the GDP of the country. Not just the GDP, in economics, the latest terms that are coming out is the GNP also, the gross national happiness. The GNH, the gross national happiness. So as a country, and if we can extend that as a world, environment would definitely improve if we take it to that level.
In fact, while we were discussing, Darshan sir, we were discussing about integrative medicine opportunities in research and drug development, as I think you had given the example of piperine being extracted from Piper longum and being added to rifampicin, and then reducing the quantity of rifampicin in tuberculosis management. And some companies have come out with products like that. In fact, in Medanta, we have done work on cancer-related drug on cisplatin plus a combination of shallaki, an extract of shallaki, and we found that we could reduce the requirement of cisplatin by half, and reduce the side effects of that. So there are possibilities which are beyond immediate clinical activity in integrative medicine, which we have found, and which are there and which we are just exploring. We have not even started looking at it. I think once people start looking at it more seriously, this will explode into an immense amount of opportunities which all of us would be benefiting from. But we will go to the next question. I would now like to actually come to the core question of this particular conference, which is or this session, which is what is the business opportunity that we can find from integrative medicine? So I would like to start with Dr. Sumana. Okay, can I?
So I'll speak from the perspective of hospitals, modern medical hospitals in the private industry. A couple of opportunities where inside the hospital that I see, one is of course preventive health in collaboration with alternative systems of medicine. Modern medicine we can do wonders with preventive health. The second area I see is non-communicable diseases. There's, I think, 63% of the disease burden in India today is because of NCDs. And modern medicine can be complemented extremely well with traditional medicine in the area of non-communicable diseases. The third area that I see is pain management. Both chronic pain, which of course goes without saying, but also acute pain, especially post-operative pain. The fourth area, in fact, there's this academic consortium in the US which has members like Harvard Medical School, Cleveland Clinic, Mayo Clinic. They also have a policy working group which is in touch with the Joint Commission, which carries out accreditation of hospitals around the world. They are looking at including pain management standards which are of non-pharmacologic origin. In Joint Commission, the pain management score, they're going to score basis whether you're using drugs or you're not using drugs. So pain management is another area that I see. India is a hub of medical tourism, and India has this unique advantage of having modern medical hospitals at par with the best in the world, and also the ancient tradition of Ayurveda, Yoga, Siddha, Unani, and the like. So medical value travel is also an area where I see a lot of business opportunities for a private hospital. And last but not the least, we're only focusing on patients thus far. But who are the people who provide care to the patients, the medical personnel? And I can say this from experience that providing medical care is physically exhausting and emotionally draining completely. So, and we as doctors have to get it right the first time, every single time. So managing our own health as doctors, as nurses, as technicians, whether we use yoga, whether we use music therapy. I worked in hospitals where we had music being played in the operation theaters, which had a calming effect, so to speak. And I don't know how it worked, but it worked. So these are the opportunities that I see within a private sector hospital.
All right. What would you say that as a business opportunities in surgery?
Yeah, like doctor said, see, right now we are more focusing into the medical value travel or medical medical tourism, wherein now the people are coming from outside to India is based on the costs. because we say that our cost is almost 1/10 the cost of that is being from the developed countries. And but going forward, I think we will lose that chance, because some other countries with maybe lesser cost can provide the same thing. So what else? What will be our differentiator? Whether the quality will be the main USP, because some other countries already, like Singapore, some other countries already actually gained that kind of a brand image that they have the best quality in terms of providing the medical tourism or the medical solutions. So other than that, I think the differentiator will be to give a complete healthcare delivery, especially in the global health supply chain. The complete health delivery can be done in India, because we have these AYUSH systems along with the modern, the quality-oriented, very good hospitals in India. So if we can combine, if we can integrate it well with all the protocols and the methods, and if we can position it well, I think India will be the number one, or will be number one country in the entire world in terms of delivering the health. Will be in the number one in the global health supply chain.
But Pankaj, would you like to add, what is your thought about the business opportunity in integrative medical sphere, and how well we can improve upon it? And what are the things which you should look into before you enter into that? Like, many people have not yet gone into that. So if somebody is coming new into that, what will be the thing that you would be looking at as a person who is providing integrative medicine in your hospital?
Okay. So I think first of all, just to answer the question more broadly, if you take health and wellness at one end of the spectrum and you move all the way down, including preventive health, early detection, treatment, post-treatment care, all the way till end-of-life care, I think business opportunities for integrated medicine exist anywhere and everywhere on that spectrum. And the real question that is to be asked is, when you look at capturing on these business opportunities, the entrepreneurs, the investors, the people who will actually go and seize this challenge, the question is really, where on that spectrum is your passion to go and actually capture this challenge? The second thing, of course, will then be that there will be certain amount of work that will need to be done to actually dig deep and actually capitalize on that opportunity. But I think there's no doubt in my mind that this opportunity exists. Now, the real question is that we have so many people attending these kind of conferences. We are sitting up here talking about the benefits of integrated medicine. I haven't heard anybody say that we don't think this is a good idea. So the question that comes, which is obvious, is why has nobody become a multi-millionaire on the back of integrative medicine therapies? Why don't we have the Bill Gates of the world who made his fortune on integrative medicine, if it's such a phenomenal thing? And I think that the challenge is actually different in different aspects of that spectrum. So let me for a minute talk about the space which I'm more familiar with, which is the provision of healthcare, the provision of disease management. And I think what's happened is that both from the healthcare professional side, as well as frankly from the patient side, what happens is actually that we take only the traditional Western medicine, so-called modern medicine, as the acceptable standard of treatment. So if you walk into a modern hospital like Medanta, which has all the best of equipment and the best of technology, and somebody says, no, you don't need any of this, we are going to treat you only with these herbs, the first reaction of the patient is, are you trying to cheat me? And I think that the reason for that reaction is that, frankly speaking, in traditional medicine, we have not done enough of a good job of explaining the values and virtues of this form of medicine. And I think this question came from the panel earlier about, what is the research which we are doing? And Dr. Geeta, you mentioned that we have done a bunch of publications. The problem is nobody knows. The problem is nobody knows, and also you have a problem that the people who are on the other side don't want to believe, whether it is because of vested interest or because of ignorance. So in our hospital, we have over 800 doctors that practice there. And there are at least 50% of those doctors who are completely convinced and committed to integrative medicine. But what that means is that there's an equal 50% who are completely not committed to integrated medicine. And we need to ask ourselves a question, why? How do we win over that side of the spectrum? And how are we able to actually convince the world that this stuff works, this stuff is genuine, it is backed by science and logic, and actually we are in a position to actually take what unfortunately has become the standard. Today when we talk about does this drug work or does this medicine work, the first question we ask is it FDA approved? Because we have accepted the fact that the United States FDA Drug Administration is the only acceptable stamp to say this product or technology works. Why? So we don't have an equally robust system of certifying the efficacy of this system that is accepted in the world. And I think that is our fundamental challenge. Because business opportunities will come when we get mass adoption of this kind of treatment. And mass adoption will come out from this kind of treatment when public at large believes that this certificate, whatever the certificate is that we give, is an accepted certificate for standard of care.
It's really good, because I would like to now, based on that Pankaj's answer, I would like to ask Dr. Trolley, who has a deep knowledge of the Indian conditions as well as the US situations. What do you think is the business opportunity across the globe, especially in terms of India or US in integrative medical sphere?
Yes. Well, it's interesting to note that the integrative medicine has a more positive view, I would say, in the West than it does in India, because there's a recognition that the modern medicine has reached its limit in certain areas. And particularly now we see issues like the opiate addiction that's going on in the America. For example, the US has 5% of the people consumes 80% of the world's medical opiates. We also have the epidemic of depression. 30% of the elder population in America is depressed clinically by study. And even antidepressant drugs are appearing in the water systems in some parts of the country. We're seeing a breakdown of the medical system. We now have also a massive epidemic of obesity starting with children, a condition that's very easy to see, but very difficult to treat. So there is now a looking for new solutions. Now this doesn't mean there's not a tremendous resistance in the medical establishment, but they are having to accept their limits. And what we see in India today, in India you have, of course, epidemic of diseases like diabetes, which are largely more based on lifestyle and basics of living than simply drug-based treatment. So globally, the place for integrative medicine is increasing, and one area that it needs to be targeted more is with the businesses, because the businesses are also now looking for places to send their people for health improvement, rejuvenation, conferences. That's why we have what I would call the new spa. Paradigms. The integrative medicine gives many potentials also for working in communities, because the integrative medical center will have more community outreach, and also for providing jobs for the new complementary systems of medicine. Practitioners cannot always stand on their own, but part of the integrative clinic they can do very well. So that future is very bright. And because India has that tradition, India has the world's oldest and best system of integrative medicine and integral view of healthcare, it may as well benefit from that starting here, and then as you can see, all the aspects of the medical tourism and sharing that globally. If yoga can go globally, all this AYUSH, all this integrative medical systems from here can go globally, and they can also help us integrate the different forms of medicine we have from throughout the world, because it's not just putting them all together haphazardly, it's finding out what works best for what conditions so that we can treat not only the most acute conditions, but also the long-term chronic and lifestyle conditions.
Professor Darshan Shankar, would you like to elaborate on how a university or an educational institution can take up this possible opportunities of integrative medicine and make sure that there are people who understand how to bring that into practice in society?
Oh, you want me to switch from business opportunity?
No, I wanted to talk about business opportunity, but based on a university professor's model.
No, I'd like to say I'm glad that there are no Bill Gates in this space, because, you know, I mean, this has to be ethical business. I once overheard Mr. Ratan Tata say, you know, I don't want to make money out of someone's misery. You know, that's not a good way to earn a lot of money. So, I mean, this is a very ethical, this has to be an ethical space. I don't think you can make a great deal of money out of this kind of health business. But there are indeed lots of services that can be provided, you know, in this integrative space. I think just for that idea that I spoke about earlier, the fourth tier, where millions of people are involved, it's a health education program. These are something that many universities should participate in. And you can model this health education program, you know, like a Google, you know. You can provide reliable healthcare information which people can use for prevention, for wellness, for treating common ailments, with themselves as the provider. Though there is a business model in that, I'm just saying, because I'm rather ignorant about business models, but I'm saying something like a Google kind of a thing for the fourth tier. It's because the users are millions of people. So I think that's one opportunity to create a Google for the fourth tier, you know, where reliable health information is provided to millions of people to empower them to become self-providers. I think there's a lot of business opportunity in new kind of drug discovery. The current kind of drug discovery that is happening in modern medicine is very skewed. These are very powerful drugs. Generally, they are very good for acute conditions and emergency conditions. They're not good enough for chronic conditions. They're dangerous, in fact. They're neither good for common ailments or for prevention. I think a very creative drug discovery platform can be made when you, as a service and as a business opportunity, where you combine the holistic nature of Ayurvedic drug development, which is a subject called Dravya Guna Shastra, and when you make a platform with Dravya Guna Shastra and what is called network pharmacology, when you combine these two, you have a very, very powerful platform for designing drugs with minimal side effects or with practically no side effects. Because it's a very, very powerful platform, it's a very technical subject. In the university, we are experimenting with this platform, but this is another opportunity, that you create a more holistic drug discovery platform where the drugs that you produce are much more holistic. I mean, not drugs with side effects, that you take something, it's banned 5 years later, you take something and after some time it punctures your intestines, you know, you take something for one thing and it damages something else. So I work with neurobiologists in the university and they say, you know, we have these molecules which can improve memory, but they also increase the anxiety. So you can't really use them anymore because, you know, you don't want a drug that improves memory and increases anxiety. And in that same experiment, when you use a plant like Brahmi, you know, Indians here know the plant, Centella asiatica, Bacoba moneri, then that's a plant with zero side effects. There's absolutely no doubt. We've done experiments that in the hippocampus region of the brain, you have molecular changes, you have synapses forming. It does increase the memory and has no effect on anxiety, etc., etc. So you can really do drug discovery services combining traditional pharmacology and modern pharmacology. It will be a very, very innovative thing in the space of integrative healthcare. As I mentioned earlier, you can create wellness science, you can create parameters for biomarkers for samadosha, samadhatu, samagni, etc. You know, and some work on these things have begun. I mean, today biomarker science is expanding in such a way that you can even use what are called exosomes, which are, you know, things which come out from your breath as biomarkers. And so there is that kind of a science developing. So you can develop a wellness science, and that is again a very, very, it will go into practice, it will go into products, it will go into services. So there's tremendous opportunity in that. In the conventional space of integrative healthcare that Medanta and institutions like this are doing, you can create spaces, you know, the best management of stroke, for example, will only happen on an integrative framework. It will simply not happen on any, on the Western medicine framework itself, because that has got something very good to offer in a window of 4 hours post a stroke, but beyond that they have nothing much to offer. It's a very routine kind of physiotherapy, and those of clinicians who are here would know that if you have an integrative stroke management, it will be the best in the world. You know, combining, and you know, so there are business opportunities like this in integrative healthcare, provided you position them like that, provided you invest in them appropriately, and so on and so forth. I mean, I've heard Naresh Trehan himself tell me many years ago, saying that in cardiology, if we combine Ayurveda, yoga, and modern surgery, we'll probably have the best cardiac care in the world. But he said, I simply have no time to devote to develop that protocol. But, you know, so in that space too, so opportunities abound.
Yes. Now, let us come to the core of the matter. I think we have been beating around the bush. We are talking about like business opportunities, and business means money. So can any of our panelists tell us some kind
Excuse
of
me.
model? Which
I had a
actually,
comment.
Yeah.
Can I, or you can finish
please,
it.
please.
I heard all of you. I was very much impressed. I'm a physician practicing in US, teaching integrative medicine. I'm board certified in integrative medicine. I've taught at UCLA. I understand from Pankaj's point of view also. I have an MBA, so I have business management. And the concept of integrative medicine is, all of you have very interesting and good comments. But in reality right now, we have an opportunity of actually practicing integrative medicine and doing clinical trials like Mr. Shankar pointed out. At present moment, we already have it. We are doing it. The world doesn't know about it. Is exactly what Pankaj you were talking about. There is a software where you could utilize a methodology in which, like Dr. Arora and I practice, a physician is practicing seeing patients with symptoms and inputting information. It's electronic health records, integrative approach. And with that system, while we are doing it, at the same time at the back end, it's also inputting data from Ayurvedic point of view. So it is using the best of the Ayurvedic practices, using the best of the modern medicine. It is scientifically validated basis. And we can use some technology. We can use something like heart rate variability to assess the constitution, the prakriti of the patient, because nowadays the pulse diagnosis is a dying art. It's practically totally dying art, and hardly anybody practices it. Now, because of the technology, we are able to actually get that information rather than from radial artery, from a digital thing, using photoplethysmography. We can just use the back end of this smartphone, and putting a finger, we can find out the constitution of the patient. When we can do that, then we might be able to do the research correctly, like Dr. Frawley pointed out. It would not be disease-based. It needs to be constitution-based. The concept of Ayurveda is constitution. Find out the constitution of the patient. If we can find out with modern technology like this or other methodologies, we'll be able to find the constitution. So once we know the constitution, right now even Ayurvedic practices of medicine, we are actually combining several drugs, and I'm using the word drugs, means any medicines, herbs, we're combining all of them. So suppose there's a patient who is a diabetic, and we are giving an Ayurvedic product which has got 15 medicines. It might be that all the 15 medicines might be helpful for diabetes, but they might be 6 or 5 of those medicines may be aggravating their constitution. So if you do not know what their constitution is, and you treat them with these medicines, you are benefiting the disease, but harming maybe the basic constitution of the patient. The research which is presently being done is we take 1,000 patients, we give a particular medicines, and find out if it works or not. 600 patients works, it's 60% effective. But if we do a constitution of the patient first, then do the medication, and then find out that those 600 patients were Vata constitution. So the medicine really was 100% effective. So there are methodology, and this software, while we are doing it, the clinical research would happen at the same time. Like Mr. Shankar pointed out, when we do the clinical research, it will happen while you're seeing the patients. What better method could that be when the clinical research is happening while the patient is being seen by the physician? This methodology is happening. So what you're talking about is practical and is doable. It is so that it can be evidence-based, and like Dr. Frawley pointed out, India is the best place for that. That's why I'm US-based and teach at UCLA, but I come back again and again because I believe this is the best place for it to get to the world rather than world from US it's come back to here. That's what I come back on a regular basis for many, many years. I've met with some of you, and I believe what you have talking about, because that's what we do. There's boards of integrative medicine. I'm board certified in integrative medicine. I teach integrative medicine. I'm board certified in family practice and geriatrics. I've done MBA. So I understand the business management or how the business opportunities are there in the whole aspect. But the comments which you were making were wonderful, and I really, truly appreciate, but I just wanted to let you know that that's happening. It's not a future. It's happening today. And if you're interested, we can talk individually at another time, because this is actually happening. What you are thinking about we need to do, we can do it today. It's not something that we need to think about doing it tomorrow. If you use that approach, yes, I believe India will get to the world and give the world what it really has, and using it in a scientifically validated, clinically validated, and cost-effective way. That's what I put my MBA hat on, and it is population management and chronic disease management. That's exactly what it is.
Thank you. In fact, I think we have been very generally discussing, but these are things which we have already been doing. But we are talking in a very base, strata of I think group of people. So we didn't go into the details of what we are doing. We are already doing what you had said, and in fact, we are collecting our data in EHIS. We are analyzing that with softwares and SSPS and which is integrated into the research system, but we are already doing it. But of course, it is really nice to know that you have developed that, and especially from an integrative medical point of view, we would like to see that. And it will be very interesting to see whether we could add on to whatever knowledge of, body of knowledge we are already having. But coming back to the point, I think if we can talk about a real, or rather, a business opportunity which actually can be, picked up from the integrative medical sphere right now, which an entrepreneur in the country or outside the country could be interested in taking up and moving forward. I think Pankaj, your opinion would be very valuable in that.
So, I think one of the challenges, and just react to the comment. One of the challenges that we face in India is not that we can't do it. The challenge that we actually face is that we can't scale it. And if you look at this from a business opportunity point of view, the issue is not can we do the pilot or can we run it in 1 or 2 places. The issue is can we scale it to be meaningful and sustainable. I think a lot of people talked about a lot of the various business opportunities. I'll touch on just one very, very simple thing from the provider standpoint, is that today if we think about, and we do this at Medanta, and frankly we would like to scale it up. If you think about building a hospital, whether it's 100 beds or whether it's 1,000 beds, if you think about the amount of space that we allocate in our physical infrastructure to traditional forms of medicine as part of the business case for building these hospitals, I think when you look at it pure, just looking at saying what is the revenue that I will generate from one bed where I do so-called modern medicine, and the revenue that I will generate from one bed where I will do traditional medicine, frankly the economics doesn't work. The revenue per bed from modern medicine is about 4 times the revenue per bed from traditional medicine. Now, if I as an entrepreneur have to put money down for 100 beds, my first question is what is the revenue that I am going to generate from each one of those beds? That's what basic business sense will tell you. The problem that I think exists is, and this was mentioned earlier, is that healthcare is not basic business. Healthcare is different business. And so I think that if you're looking for a business opportunity where you're trying to say that as a provider, how can I holistically for the long term actually generate the highest return on my investment? I think the case for Ayurveda or traditional medicine makes sense. Now remember, today you're sitting on an environment, particularly in India, but all parts of the world, where there is actually a complete absence of trust on all private healthcare providers. And that absence of trust is basically driven by the fact that the public thinks that private hospitals or private healthcare practitioners are only doing this business to make money and have lost the concept of the care element of healthcare. And so you actually look at a very hostile environment that has gotten created, which is extremely negative and extremely harmful for society as a whole, where there is an absence of trust because the person who is coming to seek the treatment is suspicious of the person who is providing the treatment. So when you look at a hospital and you say, if I just take 1%, or not even 1%, 0.5% of my investment in putting up a healthcare facility, and I actually look at saying, what can I do with traditional forms of medicine? What can I do which has nothing to do with disease care but with health? For every one patient that you don't operate on or don't treat, they will go and tell 10 patients that this healthcare practitioner is a trusted practitioner because they didn't force unnecessary medicines or unnecessary procedures on me. And I think if you look at this business case slightly more holistically than saying on each bed what's the kind of return that I'm going to make, I think in the long term when you look at businesses having social responsibility, especially in healthcare, when you look at businesses slightly different from where you may look at, or how you look at business in healthcare slightly differently from how you may look at it in other industries, I think the business case for integrative medicine is a no-brainer. Because at the end of the day, what you want to be telling patients as practitioners of healthcare or as doctors is, please don't come to us, we don't want to see you. There is no better marketing tool that you can have than the patient who doesn't need to see you. And I think that if you establish this as part of your ecosystem, as part of your philosophy, I think the business case for those unfortunate people who have no choice but to see you will be possibly 10 times what it would be otherwise.
May I just make a small comment on what you're saying? Since I'm also a business administrator, professor at the university, I just wanted to correct that if you say that if you look at the revenue per bed for allopathic medicine, it is much higher. Please take also into account the expenses are also higher. And that's why I think that you can make a business case that right from the beginning, integrative medicine will win the case from business perspective.
Thank you. Noted.
I just want to support to what he said. That means the investment on sophisticated machines or that kind of tools, etc., is not there in case of actually investing on the other system, AYUSH systems. That is on one side, and as well as see. Nowadays, maybe on when we start the integrative department, maybe to start with it will be something like a loss-making kind of thing. But over a period of time, it can add value to the main business. The core business gets a different position altogether once you have the integrative medicine in practice. So going forward, I think if you calculate, like Pankaj said, calculate on an assorted base, on a complete consolidated base, it will be more viable in terms of business.
In fact, I agree with you, and I think that's the experience which we have with Medanta. In fact, when we add yoga free of cost to all the post-CABG patients, like the kind of acceptance the patient has even for the surgery is much better. So I think the addition of traditional medicine interventions, even if it is free of cost, if it is possible to be given free of cost, actually makes a lot of benefit to the business in the total business. Sir, would you like to make a comment on that?
Can I ask a question for the panelist? It was an excellent discussion.
Just it's not over. You can come back to the question. We'll come back to the question, please.
Just a quick comment here. In America, what they found, the yoga groups were able to put together, showing that people who practiced yoga were healthier. And so that got the insurance companies to support yoga because it lowered the cost in the insurance companies. So that's also a cost benefit that should be brought into consideration for the integral and integrative health.
Well, I think most of the points have been covered. I really don't have anything to add to this.
In fact, two of our panelists have to leave early. And Dr. Sumana and Dr. Darshan Shankar has to leave early. But I think we can take a few questions, and I think we have a few integrative medicine practitioners over here already from different parts of the world. Dr. Anupama from US, probably. Dr. Anupama, would you like to share your experience in the university?
Yeah. So in our university, like past 15 years, we are trying to implement the integrative medicine, but one of the huge challenge we are facing is the financial part. How do we start from the beginning? Like to have all physician or practitioner in same room and discussing about the same patient, it's very expensive model. So what we are doing is the same patient, we have different type of care, but I don't completely agree that that is an integrative model. Because I recently completed a clinical trial for integrative care for low back pain patient. And each care had a benefit, but that particular trial didn't include Ayurvedic medicine. But we couldn't find very effective in the integrative model really played a major role in management of the low back pain. The challenge what we noted there was no collaboration between the practitioner. So when we thought that bringing a collaboration between the practitioner for one single patient, that costs a lot of money. So that's a huge challenge we are facing right now. Thank you.
Sir, you had a question.
This concept of integrated medicine, it's excellent and great discussion. But if I go back to my village and I want to bring this to a common man who works on the field or drives a rickshaw or drives a car, how do I sell the concept of integrated medicine at that level, or how can I make it work?
Are you a medical practitioner?
Yeah.
Which kind of medicine do you practice?
I am a traditional, like allopathic medicine.
You're an allopathic medical practitioner?
Yeah,
Okay.
but I have an interest in wellness. And if I have to bring it to a common man, how do I get it there? Because I feel it a struggle to sell wellness to somebody who comes to see me for disease.
I'll just react to that. I think you're asking the $1 million question, and I don't think anybody has solved it. The US is spending billions of dollars trying to address this problem. What you're asking is, how do we change human psychology to make people do the things that they're supposed to do instead of the things that they're not supposed to do? I bet you talk to anybody who smokes, they know it's bad for them, but they still don't quit. So I don't think there is a very clear answer to your question. I think, however, what actually works is, how do you not find an individual and force that person to become healthy? I think the right question to be asked, for which again I don't think there's an easy answer, is how do you look at society and force society to become more healthy? And I think if you study what is happening in other parts of the world, and sadly we are not too focused on this in India, what's happening in other parts of the world is that systematically there is societal pressure on the things that create negative influences in healthcare. So if you look, and over the last maybe 20 years, in many parts of the West, maybe more successfully in the US than in Europe, smoking has come under huge amounts of attack from society pressure. I was actually reading, which actually surprised me, I did not know this. A very prominent major hospital group in the United States, the Cleveland Clinic. You cannot get a job at the Cleveland Clinic if you smoke. This was a practice that they implemented some years ago because they said, if our responsibility is to treat people, how can we encourage those people who are forcing the healthcare costs in the United States to rise? If you look at what is happening in the United States today, the victim is sugar. Everybody is coming after sugar. So if you look at what big companies like Coke and Pepsi and all of these people are doing, what are they doing? They can't sell you Coke anymore, so they have to sell you water now. So society will move, I think, will help move the needle in that direction. I don't think you as an individual crusader are going to be able to go back to your village and suddenly change the psychology and behavior of all the people. But I think if you can figure out some small way to create a societal movement towards better healthcare, I think you may be a little bit more successful.
I'd like to comment on that. In US, what they use is a carrot and stick method, and what they do is health insurances, because everything is insurance based. So if you are healthy, if you show that you are healthy, you're not smoking, then you pay less premiums. So similar carrot and stick psychology can work anywhere, but the psychology and the management might be different. So in his village, if there was some way, he could figure out a way where by being healthy, there would be less disease, which they already know. But if it's monetary related, something which can give them some sort of a positive that they have to do, that they will get a benefit out of, that might do the trick. Because like in US, just increasing the taxes for smoking, if you make it so expensive that people will gradually stop buying it. I mean, you have to do all other methodologies too. So in a small village, it might be difficult one-on-one, but the concept is this, because that's what the human psychology usually will respond to, generally.
It's a very interesting thing. We have a heart disease reversal clinic at Medanda. So what we do is, we identify the patient and then we discuss. We have a group of doctors. We have an Ayurvedic doctor. We have an allopath cardiologist. We have an endocrinologist. We all sit together along with the dietitian and speak to the patient who has early cardiac, like disease. And we tell them that, okay, now you follow this diet, and we have a coordinator who will call the patient every week. Now you know what happens. Out of the 50 patients we had done, only 2 of them would pick up the phone after 3-4 weeks, and they don't want to hear this voice saying, and please, are you doing your yoga? Now these guys don't even pick up the phone. Now few of them abuse the guy, saying that, why are you calling us? So it's very important to change the psychology of the society and the psychology of the people, because I don't think that we will be able to change individuals as easily as I think probably we might have to do a little more work in changing the social psychology, but it might have larger effect and long-term effect. That's very true. So are there any other questions or?
No, just sharing a thought which links all this, which is I'm part of a group that's looking at fitness bands and a certain set of sensors that can actually look at the constitutional side and report in via the insurance mechanism, etc. So there are some people working on large-scale disruptive business systems with pathways for money, etc. So the fitness, the wearable and the appropriate set of technologies on the sensor side will provide the right kind of data to the right kind of people who will incentivize you financially. So no one needs to call. You just need to walk, and it will be done. So your insurance premium will get reduced. I mean, just in a manner of speaking.
But the fact is, even the wearables are not finding to be, extremely effective in making people do the exercise. The wearables keep on beeping, but people do not, like.
Yeah, but the point is not that. The point is when you link it to insurance. So I didn't elaborate much, but essentially the wearables technology must be linked through the data, back through the insurance company to pay you back the money. Once that happens, people will do what they do.
Well, in the Indian context, I'm not sure if the Supreme Court would jump in and say it's an invasion of right to privacy.
It's also another possibility. Dr. Ajit?
Yes, first of all, thanks.
New Zealand and has a lot of experience in at least working with the New Zealand environment in integrative medicine. Yeah.
Yes, I think what I would like to add, and first of all the panelists, what they have said makes a lot of sense. But one thing what we are not discussing, or it has not been come into consideration, that why, in spite of all of us thinking that yes, this is the only way forward of having an integrative approach, why it is not yet being implemented or have been having a wider acceptance. And the reason what I feel is two factors. One is governments of every country is still not able to consider that part, that yes, there is a need of such approach at a government level. Because whenever anything we try to implement and get wider acceptance by the community is what comes from the higher level and is easily available, especially when we talk about the cost factor and other thing. And the second thing means we talk about it as a drug mafia, but I don't want to say so many drug people are sitting here, right? But actually that is the fact, right? Now, third factor is the respect factor. What I would like to say here, and I'm talking about the Western experiences, not the Indian experience. In Western world, we are very openly now into Ayurveda and yoga. I'm not going to talk about the other modalities. But what is happening is that the respect from the Western doctors to an Ayurvedic practitioner is nowhere there. And the reality of the fact is that people who are practicing Ayurveda in those countries, they can, what is their qualification? They can take and buy a ticket in December or September, come to India, have a 2-weekend course of Ayurveda, start pronouncing Vata Pitta Kapha, and go back and start practicing there. This is what our Ayurvedic practitioners, so-called Ayurvedic practitioners in those countries are. And then there are people who will learn Ayurveda from Ayurvedic doctors in this country. But when they go into their own country, they advocate that Ayurvedic doctors are not capable of practicing Ayurveda in that country, but a medical doctor is capable of practicing Ayurveda because he has learned from an Ayurvedic doctor in India. And now he is practicing it there. So that kind of this disparity is the biggest cause. Until we start getting a respect for each other, and yes, credibility is the also part there. We need to create that credibility among our medical community, and same medical community has to get that credibility of the Ayurvedic practitioner or other that they are capable of helping the client. And then the government involvement is the very essential part. That is what I feel.
Ajit, thank you so much. Dr. Bera, would you like to add anything? Okay, right. Thank you. In fact, we have closed our limit by 15 minutes. I think, is it okay? Right, we can close. Is there? I think it was a really wonderful session. We had a lot of inputs from all of our panelists, and I thank all the panelists for being here and and giving us this excellent insights into their thoughts about integrative medicine and business opportunities in this case. Yeah, thank you.
Yeah, thank you, Dr. Geeta. Thank you to all our panelists also. May I request you, sir, if you can present the mementos also to our panelists. So I think the verdict stands that yes, integrative medicine good for the GNH as was pointed out, but also it makes good business sense. Thank you. Thanking, Dr. Sumana Arora. Start from her. Thank you. Thank you to Mr. Pankaj Sahni. Okay. Anyways, sorry. He was standing, that's it. Professor Darshana, I think he's standing this side, so probably. Yeah. Thanking Professor Darshan Shankar. Thanking now Mr. Pankaj Sahni. Appreciation to Dr. David Frawley. Thank you to Mr. Sajid Kumar. Bunny? Just one group picture. Moderator, if you can give it. I would like to invite Ms. Bunny, working with FICCI, to kindly present the memento thanking Dr. Geeta Krishnan. Dr. Krishnan, this is for you. Thank you so very much.
Well, thank you.